Okay, so in this video, I'm going to be sharing a research paper that I conducted in 2024, 5/4/2024, on the impact of smoking on the lung cancer incidence. Now, before I begin with the introduction of my research paper, I'm just going to give a brief about the lung cancer and what this research paper is going to be talking about. Basically, the link between smoking and lung cancer has been a vital point of medical research for decades. Lung cancer is a deadly form of cancer worldwide, with smoking being a primary risk factor. Now, this research paper will investigate the correlation between smoking and the incidence of lung cancer, hypothesizing that smoking significantly increases the risk. Analyzing data and literature to understand the relationship between smoking habits and lung cancer risk. Through a review of existing literature and analysis of data from various health organizations by reviewing existing studies and statistical data. This study will aim to contribute to the understanding of how smoking influences lung cancer development with hopes of informing prevention and strategies. So, number one is our introduction, or my introduction. Lung cancer is characterized by the uncontrolled cell growth in lung tissue. This is a leading cause of cancer-related deaths globally. Despite advancements in medical treatment, the prognosis for lung cancer patients remains dire. Underscoring the need for effective preventive measures, smoking, identified as the primary cause of lung cancer, is a modifiable risk factor. This paper will explore the relationship between smoking and lung cancer incidence, guided by the research question: how significant is the impact of smoking on the incidence of lung cancer? My hypothesis. This study hypothesizes that there is a significant correlation between smoking and an increased risk of developing lung cancer. The hypothesis posits that individuals who smoke have a significantly higher risk of developing lung cancer compared to non-smokers. This paper will also examine various factors, including the duration and intensity of smoking, to assess their impact on lung cancer incidence. Now, for the results that I have analyzed, the analysis of existing studies and health data indicates a clear correlation between smoking and lung cancer incidence. For instance, Smith at 2023 found that heavy smokers are 3 times more likely to develop lung cancer compared to non-smokers. Furthermore, data from the Global Health Organization in 2024 reveals that regions with a higher smoking rates exhibit significantly higher lung cancer rates. My methodology. In my methodology, I will cover the data collection that I have collected and my analysis. First of all, my data collection. Publicly available data on lung cancer that has incidence rates and smoking prevalence should be gathered, of course, from health databases and recent epidemiological studies to access all evaluations accurately. I will not go into so much detail on my data collection, but as for my analysis, I've shared 3 graphs from my analysis, and the study employs statistical tools to analyze the relationship between smoking habits and lung cancer rates. So statistical analysis should always be performed to identify patterns and correlations between smoking habits and lung cancer rates. My analysis was focused on comparing lung cancer incidence among smokers versus non-smokers and considering the factors such as age, gender, and smoking intensity. You can have a look at the 3 graphs below to understand the analysis and the main approach of my analysis. To conclude this research paper, the evidence of my research was overwhelmingly supports that smoking is a major risk for lung cancer. This study highlights the urgent need for public health initiatives focused on smoking prevention and cessation to combat lung cancer. Future research should aim at longitudinal studies tracking smoking habits and lung cancer development in real time to further elucidate this relationship as much as possible. So that was basically it for the research that I have conducted on the lung cancer incidence for smoking. In the last page, I have shared some charts and bar graphs that I have collected to basically compare the relationships even further and get a deeper and better understanding of the situation. The first graph is basically showing us that the percentage of adult current cigarette smokers and the lung cancer death rate, comparing both of them of 100,000 people per year. As you can see, it was quite low back in 1920s, and it started to gradually increase. Both smoking and lung cancer increased together up till maximum of 1960 to 1980. After that, due to some advancements in the environment and some medications, the rate has been decreased slightly, but again, it still is rising back again. Now, the relationship perceived risk and smokers' regret among current smokers. This graph is basically comparing the worrying about getting lung cancer, the health risk from smoking every day, and the health risk from smoking once in a while. As you can see, most of the people are having regret, as that is the highest bar chart. And the last bar graph or chart is basically comparing the rate per 100,000 to the percentage of regular smokers. So that was basically it for my research paper on the lung cancer incidence. And I hope this was informative as much as possible. I tried my best to summarize it as much as possible. If you have any questions, feel free to ask me in the comments below, and I will see you in the next one.